Hello and welcome you all to the second episode of my YouTube channel called the Rheuma Talks. So today let me discuss about uric acid. So what is uric acid and the diseases that is associated with this, that is the gout. Okay. So basically what is uric acid? Okay. So uric acid, if you see, it is a byproduct of purine metabolism in your body. So everybody has uric acid levels in their body. So whether it is a male, female, it doesn't matter. Everybody has a uric acid level in their body. So the problem comes when the uric acid level in your body exceeds a threshold of 6.8 milligram per deciliter. So beyond this level, uric acid is known to cause problems in the human body. And the common disease that it causes is your gout, which is a type of crystal arthritis. Okay, so what is hyperuricemia? If they ask, level which is more than 6.8 is called as hyperuricemia. That is the reference range that is given even in our textbook also. So why high uric acid? So uric acid basically is maintained with a strict balance in the body between the production and excretion of uric acid in your body. So production and excretion should always be in a balance. So when this balance is disrupted, your uric acid levels tend to go up. Okay, so when the purines in your body go up, your uric acid levels rise. Okay, and when the kidney is not functioning properly, then your uric acid levels tend to go up, because the uric acid is excreted in our body mainly from the kidneys and from the gut. Okay, so when the kidney is not functioning properly, your uric acid also can go up. Or when there is disorder of purine metabolism, for example, that time also your uric acid levels can go up. Okay, so the next question comes, is uric acid needed for the human body? Uric acid is very much essential and needed for the human body. Only when it goes beyond a particular level, that's when it becomes pathological. Okay, why is uric acid level needed? Okay, for this let's go back to a million years back. So there was a time when we all were four-legged creatures walking on earth. So what happened a million years back was, there was a shift from four-legged creatures to bipedalism. Bipedalism is walking on two legs. So when this shift happened, there was a need to maintain the blood pressure of the human body. So the problem that time seen was, as we evolved from four-legged creatures to two-legged creatures, there was action of gravity also. So the BP tend to come down. So there was hypotension. So to counteract this, what happened was the body decided to increase the uric acid levels so as to maintain the blood pressure of the organism. But later on, this started becoming a problem for us. Why? Because humans don't have an important enzyme called as uricase. So uricase enzyme is needed for breaking down the uric acid in your body to a byproduct which can be excreted easily. Okay, we don't have this enzyme. So that's why the problem of high uric acid exceeding a particular threshold is known to cause all these problems. Okay, next we will come to diet and connection between diet and uric acid levels. Diet, if you ask me, plays a very important role in maintaining your uric acid levels in your body, because there are certain food items which can increase the uric acid levels in your body. So actually, honestly speaking, there is no limit to what a man can eat and what a man cannot eat. Okay, so but let me tell you in a very simple way, I'll simplify the diet that causes high uric acid levels. Okay, so it is best to avoid those diets rather than going into complete details of what we can eat and what not to eat. So we'll come to foods which increase your uric acid levels in your body. So these are usually your purine rich food. As I already told you, purines, finally the byproduct is uric acid. So any diet which has high purine content will eventually increase your uric acid levels. Okay, so what are these diets which are rich in purines? For example, your red meat, your organ meat, certain seafood which is rich in purines. Then alcohol, yes, it has high amount of purine content, especially the beer which has high purine content in them, mainly the guanosine content. Okay, then we should avoid something called fructose rich food, sugary, sweetened drinks which has high amount of fructose content. This has to be avoided in patients who are having high uric acid levels or gout, for example. Your purine rich food and your fructose rich food are the ones that causes high uric acid levels in your body. So we are all talking about high uric acid, high uric acid. So what problems can this high uric acid levels cause? So high uric acid levels can cause a lot of problems. One among the problem is your crystal arthritis. Okay, that is your gout. Okay, then it can present like acute episode of pain and swelling of the joint, predominantly affecting your lower limbs. That is your first MTP joint, your midfoot joint, your ankle joint, your knee joint can come with pain and swelling. And still, if you leave it untreated, it will go to something called as chronic gouty arthritis. That is another problem with high uric acid levels. Okay, then other problem is your chronic kidney disease. So having a high uric acid level eventually can cause chronic kidney disease, chronic urate nephropathy. It can also cause renal stones. Okay, then also patients with high uric acid levels, there is a direct link to hypertension also. As I already mentioned previously, what happened in the Miocene era. So similarly, applying to the current human scenario, so high uric acid level is directly connected to your high BP recordings also. Okay. Then patients with high uric acid level, they have an association with something called metabolic syndrome. For example, your diabetes, your hypertension, dyslipidemia, obesity. So there is a direct link between metabolic syndrome and having a high uric acid levels also. The next question is, you should be wondering, doctor, how do you diagnose gout? Okay, so basically gout is not diagnosed just based on the blood uric acid levels. There are many people whom I see in the OPD who come with high uric acid levels, but they don't have gout. So don't diagnose gout based on just high uric acid levels in the blood. In fact, in 30-40% of the cases, uric acid levels may be normal in a patient who is having a gout, because during an acute flare, the levels may be lower. When the flare goes away, that is during the intercritical period, that time we see that the uric acid levels may be higher. Okay, so coming to how do we diagnose gout. So gout is, if you ask me, gout is the most common inflammatory disease, inflammatory arthritis worldwide. Okay, so coming to how we diagnose gout is, what we do is when a patient is coming with acute swollen joint, for example, your first MTP joint, your ankle joint or a midfoot joint or knee, whatever the joint it is, the gold standard for diagnosing gouty arthritis is synovial fluid analysis. So what is this? So we remove and aspirate the synovial fluid from the joint and send it to our lab for confirming using polarized microscopy. Using polarized microscopy, you can see strong negative birefringent needle-shaped crystals can be seen under a polarized microscope. So this is the gold standard test that we use to diagnose gout. Then another test that we do, for example, if patient is not willing for joint aspiration and synovial fluid analysis, what we do is we do a musculoskeletal ultrasound. So in our OPD, what we do is we take the patient to our ultrasound room, then we just hold the ultrasound probe and do the ultrasound of the joint which is affected by the crystal arthritis. So that will show your classical double contour sign in the joint. Okay. If not, then we can also see tophi in the on the ultrasound. So that is another way in which we can diagnose gout. Then another way to diagnose is called a DECT. Okay, this is called a dual energy CT scan. So basically, what is this? It is just like an X-ray which is used in two different directions against a uric acid crystal which is there in the patient's body. So based on the difference in attenuation property of these X-rays, we can know that this particular object that is there in the patient's joint or the synovium or whatever is a crystal. So this is one way in which we can identify the uric acid crystals. Okay, so next we will come to treatment of gout. Treatment of gout is a bit tricky. There are various guidelines and recommendations that is given everywhere, but what I tell, it is mainly based on my experience with patients. Okay. Next, coming to treatment of gout. So treatment of gout, whenever a patient comes to me with gout, I make a checklist in my mind. So currently this patient is having an acute flare of crystal arthritis, which is gout. So acute management, what will I do? So acute management, what I will do is I will give him a good dose of painkillers. Okay, that is called as NSAIDs, that is non-steroidal anti-inflammatory drugs, that can be given, or we can give something called colchicine at 0.5 mg BD, or we can give something called as steroids also. Okay, we do give steroids in acute flare of gout. Then it can be either oral steroid, or if patient is having a single joint or a two joint flare, then we have an option of giving intra-articular steroid injection also. So that will be enough to control the patient's acute flare of gout. Then second thing that I will deal with is something called urate lowering therapy. These are drugs to reduce the uric acid levels in your body. So there are many drugs which are available. There are drugs which reduce the production of uric acid, and there are drugs which increase the excretion of uric acid. So these are called urate lowering therapies. For example, your allopurinol, your febuxostat, then lesinurad, then your benzbromarone. These are all drugs which lower the uric acid levels in your body. Next is when we are starting a patient on urate lowering therapy, what we have observed is that there is a chance that when the uric acid level is tending to suddenly come down in the body, patients can develop attacks, new attacks or flares of gout. Okay, so to prevent that, what we do is something called as a flare prophylaxis. Flare prophylaxis includes your drugs which are given basically for 3 months or 6 months from the time of initiation of the urate lowering therapies. So this can be your colchicine, it can be your NSAIDs, it can also be your steroids, for example. So these are basically drugs which have an anti-inflammatory effect, and they prevent a gout from being flared up after starting a urate lowering therapy. Okay, the next thing that runs in my mind when a gout patient comes is gout patient do have a lot of other comorbidities. For example, your diabetes, hypertension, dyslipidemia, metabolic syndrome. Some of them can have renal stones, some of them can have chronic kidney disease. So it is very important to address these multiple comorbidities in a patient who is having gout. Okay, because we need to see the patient as a whole and not just from the gout or a crystal arthritis point of view. So there are many other comorbidities which a patient can have when a patient of gout comes to us. Okay. Then the next thing that I do when a patient of gout comes to me is focusing on the diet of the patient. Okay, so diet changes can reduce the uric acid levels by 0.5 to 1 milligram per deciliter. Okay, so I advise them to follow a Mediterranean diet or follow a DASH diet, what it is called. Then what foods to avoid, I tell. As I already mentioned, there is no limit to what a person can eat and not eat. So when a gout patient comes to me and if they ask me what diet should I follow, I'll just tell them two very important things: what not to eat. Okay, so you should avoid foods which are high in purine content. Okay, then you have to avoid food or sugary drinks which have high fructose content. Okay, these are two things I tell. And other thing I tell is, please avoid alcohol, especially beer, which has a high purine content. So beer is one thing that we have to avoid in patients who have gout. So overall, summing up, the most common inflammatory arthritis worldwide is your gout. Okay, it is very important to diagnose and treat the gouty arthritis and also to address the other comorbidities that a patient is having. So dietary approaches are also very important for a patient who is having uric acid problem. Okay, so gout is a very common disease that we treat in our rheumatology clinics. So refer the right patient to the right doctor will definitely make a difference in patient treatment and outcomes. So thank you all for watching this second video of mine. So please like and subscribe. So I'll be coming out with more updates and advances in the topic of clinical immunology and rheumatology.